Hi, y'all. I'm Chelsea, and today we're going to talk to y'all about our Journal Club article.
And I'm Samantha.
Okay, so today we're going to talk to you about an article that we found in the Journal of Clinical Psychiatry. It's entitled Marijuana Use is Associated with Worse Outcomes and Symptom Severity and Violent Behavior in Patients with PTSD. The authors of this article are S.T. Wilkerson, E. Stevanovics, and R.A. Rosenheck. I'm going to start by giving y'all a little bit of background information about our article. So it's questioning the use of medicinal marijuana in PTSD patients using a longitudinal study conducted by a VA treatment facility. And the article suggests that marijuana use in PTSD can worsen the symptoms. So medicinal marijuana is now legal in 23 states. However, it's still illegal by federal law. And medicinal marijuana has not yet met all the specific requirements typically used in the Food and Drug Administration. However, PTSD has been approved in 9 states as a qualifying condition for medicinal marijuana. There have not yet been any randomized controlled trials to evaluate the efficacy or the safety of using marijuana to treat symptoms of PTSD. So the main purpose here is to determine whether or not marijuana worsens or relieves symptoms of PTSD, and we mainly use veterans in this trial. So it was in examining the association between marijuana use and PTSD symptom severity.
So the study design is a longitudinal observational study. The inclusion criteria were 12,770 veterans were found to meet the inclusion criteria. Veterans with diagnosed PTSD according to DSM-3 criteria until 1994 and DSM-4 criteria thereafter. Some inclusion criteria were the problematic alcohol use, which was more than 2 drinks on one occasion, any drug use other than marijuana 30 days prior to admission, and those who entered treatment on transfer from an inpatient of a residential program that would have restricted their access to alcohol or drugs.
Those were actually exclusion criteria, not inclusion, just to reiterate.
So the endpoint was from 1992 to 2011. Patients were evaluated at baseline and then 4 months after discharge. So the study groups were never used, which were 11,344, stoppers, which were 299, continued users, which were 296, and starters, which were 831. Some baseline characteristics were socio-demographic characteristics, clinical data, PTSD symptom severity, other comorbid psychiatric diagnosis, history of psychiatric hospitalization, drug and alcohol use severity measures, chronic medical problems, community adjustment variables, and treatment program characteristics. Some additional information were the outcomes included 4-month follow-up assessments of PTSD symptom severity, employment status, violent behavior, and a composite measures of alcohol and drug use from the Addiction Severity Index. PTSD symptom severity was measured by a short form of the Mississippi scale for PTSD, and the ranges were from 11 to 55.
Okay, so I'm going to talk to y'all a little bit about some of the data analysis that was done for the trial. So the first analysis of variance, they used ANOVA, and it was used to compare baseline characteristics of 4 marijuana use groups. So 5 outcome measures were examined and the sample size was substantial. An alpha level was set at 0.01 and was used to test statistical significance. A linear multiple regression analysis, including all marijuana users, was conducted to examine the association of change in days of marijuana use from before to after program entry, and change in PTSD symptoms, violent behaviors, days of employment, and the ASI, alcohol and drug use composite score. So the regression analysis showed statistically significant positive associations with increased days of marijuana use and more severe PTSD symptoms, violent behavior, and alcohol use. So the sample consisted of 2,276 patients with an average age of 51.7. Most of the participants were white, making up 72.2%. 21.2% were African American, 40.7% were married, another 40.7% were either separated or divorced, 51.4% had a history of incarceration, 28.4% had some sort of comorbid psychiatric diagnosis, including affective disorder, and 12.2% had anxiety disorder, 8.2% had personality disorder, 4.3% had bipolar disorder. Psychosis other than schizophrenia made up 1.9%, 0.8% had schizophrenia, 86.2% had been prescribed some sort of psychotropic medication in the last 30 days, and the average length of stay for participants was 42.5 days. The participants who never used marijuana were an average age of 53.2 years old. They had the lowest baseline ASI composite scores of both alcohol and drugs. The never user group had better measures of community adjustment with lower rates of incarceration compared to the starters and the continuing users, lower measures of violent behavior compared to the stoppers and starters, and more likely to attend reunions after discharge. In measures of treatment process, continuing users had shorter lengths of stay compared to never users and starters. So you had a 38.2 versus 44.8, and that made up 42.8 days respectively, and were less likely to be on a waiting list than never users and starters. So the percentages were 53.9% versus 68.2% and 64.9% respectively. Other than the history of war zone groups did not offer or differ in measures of PTSD, other psychiatric disorders.
So the results of this study were that marijuana use was significantly associated with worse outcomes in PTSD symptom severity, violent behavior, and measures of alcohol and drug use. Stoppers and never users had the lowest level of PTSD symptoms with a p-value of less than 0.0001, and the starters had the highest level of violent behavior with a p-value of less than 0.0001. After adjusting for covariance and using never users as a reference, starting marijuana had an effect size on PTSD symptoms of plus 0.34, and stopping marijuana had an effect size of negative 0.18. So in conclusion, in this observational study, initiating marijuana use after treatment was associated with worse PTSD symptoms, more violent behavior, and alcohol use. Marijuana may actually worsen PTSD symptoms or nullify the benefits of specialized intensive treatment cessation or prevention of use may be an important goal of treatment.
Okay, so some of the discussion points that were made in the article. The data was collected and showed that initiating marijuana was associated with higher measures of PTSD symptoms at the 4-month follow-up with a modest effect size compared with never users. Stopping marijuana use during treatment showed the most improved outcomes, and the data analysis also showed that increased marijuana use was related to more severe PTSD symptoms. There was a robust association with the initiation of marijuana use with higher follow-up measures of violent behavior. The author also stated in the discussion that their findings were consistent with previous longitudinal studies of the relationship between marijuana use and PTSD, and with a previous study that was used for substance abuse, a previous study of substance abuse more generally in PTSD. So, some of the strengths and weaknesses of the trial. So, I'm going to start with the strengths. So, there was a large sample size. There was a refined exclusion criteria that had not been done before in similar studies of PTSD and medicinal marijuana. So this study excluded patients who had a history of alcohol abuse or who had used any other drug other than marijuana in the 30 days before coming to the trial. So before, they didn't exclude patients for those reasons, and in this they did. So that allowed for a more pure sample. There was a short follow-up duration period of 4 months, and biases were minimized based on standard psychometric data. So some of the weaknesses: none of the participants were actually prescribed any sort of medicinal marijuana, and there were no defined doses, quantities, or frequencies to use the marijuana. So there was a note in the discussion talking about how there has not been specified treatment guidelines for medicinal marijuana use in PTSD, and that most of the trials that are looking at medicinal marijuana use let the participants self-titrate. So drug use was not verified by toxicology screening. It was only done by self-report, and therefore they couldn't test for levels of cannabinoids in the marijuana the patients were using. So there was unmeasured differences as far as impulsivity and antisocial behavior among the participants, and the study was limited to older males with long-standing PTSD. So it didn't give you a really good look at the general population. So we feel that there's not enough information or evidence here to make a conclusion that medicinal marijuana use is not an effective treatment for PTSD. Though there was a lot of evidence to suggest that marijuana was associated with an increase in symptoms and violent behavior, there are a lot of other contributing factors that could have played a role in these findings. A lot of these patients had some sort of comorbid behavioral or psychiatric conditions that could have also led towards their aggressive behavior and their PTSD symptoms. And there were no standards in treatment or clear guidelines for the patients to follow as far as how to take or when to take the marijuana. So we realized there was an interesting correlation between marijuana use and the starter group and an incidence of increased symptoms, but this alone is not for us to say that marijuana use is definitely the cause for the increased PTSD symptoms, considering all the other limitations of the study. Medicinal marijuana use is still a fairly new concept, and there is still much to be learned about whether or not this is an effective treatment plan for certain disease states. So based on the study, it is safe to say that caution should be used if patients are considering marijuana use as a method to treat their PTSD, and depending on patient history, it should probably be avoided. However, we would not completely rule out the option until more studies are done on the topic. We also would not suggest it as a standalone treatment in PTSD. So we feel that more evidence could come from conducting a randomized control trial to have more of an understanding of the effects of marijuana use based on a more controlled environment. And that is all we have for y'all today. Thank you for listening. Goodbye.